Hello, I'm Dr. Kilner Bavalia and I'm here to explain what will happen at your cervical screening appointment. What is cervical screening? Cervical screening is not a test for cancer. It helps prevent cervical cancer by checking for a virus called high-risk HPV and cervical cell changes. Most cases of cervical cancer are caused by human papillomavirus, HPV, which is a common virus that most of us will have at some point during our lives without knowing. HPV lives on our skin, so it is easy to get and difficult to completely protect against. HPV can stay in the body for many years. It can stay at very low or undetectable levels and not cause any problems. However, sometimes it can cause abnormal cells in your cervix to develop. These can, over time, turn into cancer if left untreated. The test only lasts a few minutes and you only have to go once every 3 or 5 years, depending on your age and where you live in the UK. You can have your cervical screening at your GP surgery and it's usually carried out by the practice nurse. In some areas, you can have it at a well women's centre or sexual health clinic. Results are usually received by letter within 2 weeks. Who is eligible? All women and people with a cervix between the ages of 25 and 64 should attend their cervical screening. Those registered as female with their GP will be automatically invited for routine screening and should receive their first invite a few months before turning 25. Trans men registered as male with their GP aged 25 to 64 are eligible for screening if they have a cervix. They can arrange an appointment with their GP practice or a local sexual health clinic. What happens during your cervical screening? Cervical screening involves taking a sample of cells from the cervix, which is the opening of the womb. The person carrying out the test will ask you to undress from the waist down and lie down on the examination couch. They will ask you to bend your knees and open your legs. A smooth, tube-shaped tool called a speculum will be inserted into your vagina and used to open the walls of the vagina so that your cervix can be seen. A soft brush is then inserted through the speculum to your cervix. The brush will rotate a few times to collect the sample. The brush will then be washed in a specimen pot and the pot will be sent to a lab for testing. How you can make your screening more comfortable. Your nurse or doctor performs cervical screenings regularly and will work with you to put you at ease. Here are some tips to make your screening more comfortable. Wear a skirt or long jumper which you can keep on during the test. If you forget, don't worry, you'll be given a paper sheet to cover yourself. Ask for a smaller speculum. Speculums come in different sizes, so if you find the standard size too uncomfortable, you can ask to try another size. Ask to lie in a different position. Lying on your back may feel uncomfortable. You can ask to lie on your left-hand side with your knees bent, or speak to your nurse or doctor to see what they suggest. Try relaxation techniques. Your nurse or doctor can recommend breathing techniques to try. Listening to a podcast or music may also help you relax or distract you. Talk to your nurse or doctor during the test and remember, you are in control and can ask to stop at any time. Speak to your GP about taking someone you trust to your appointment. You may be able to take someone you trust to the appointment if you need to. Please check with your GP practice when booking your cervical screening appointment. What happens after your cervical screening? Your nurse or doctor should tell you when to expect your results during your appointment. Results are usually received by letter within 2 weeks. Your cervical screening sample is first tested for high-risk HPV. HPV primary screening is a more sensitive and accurate test than the previous method, cytology alone. This is the best way to find out who is at higher risk of developing the cervical cell changes that over time could potentially lead to cervical cancer. Cell changes are easily treated and this prevents cervical cancer from developing. But don't be alarmed, as having HPV does not mean you have cervical cancer. Your results letter will explain what was tested for and what your results mean. Cervical screening saves lives. Don't ignore your cervical screening invite and book an appointment with your GP practice or local sexual health clinic now if you missed your last one. Cervical screening can help stop cancer before it starts. Find out more at nhs.uk/cervical screening.